This video abstract provides an overview of our manuscript titled Parents' Perspectives on Early Relational Health, a Qualitative Study. The American Academy of Pediatrics identifies early relational health as providing a framework for pediatric clinicians to support development and promote resilience in pediatric clinical settings. Little work to date has explored parents' perspectives on this topic. Further, far less is currently known regarding parents' views on routinely addressing early relational health in pediatric settings and how clinicians can do so most effectively. In this study, we used qualitative research methods to further understand parents' perspectives on early relational health and the role that pediatric clinicians play in promoting it. We conducted 8 virtual focus groups, purposefully sampling a diverse group of parents of children ages 7 years old and younger. An interview guide was prepared using input from community partners and parent advisors. All sessions were recorded and transcribed verbatim. All data was analyzed as it was collected, and themes were identified using an inductive and iterative process.
I had the honor of supporting parents to be involved in the Parent Advisory Committee that informed every phase of the study. 3 main themes were identified from the focus group data. First, parents identified time spent with their children, focusing attention on them, and open communication with their children as important factors in laying a foundation for early relational health. Second, parents felt that pediatric clinicians could be potential allies in supporting early relational health and child development. However, a lack of connection with clinicians was a major barrier to achieving this. One father said, "So these interactions, I would call it a relationship between doctors, kids, and parents. It's extremely important, and if all these 3 dots are joined together and act on one right direction, I think we can provide our kid a very healthy upbringing, whether it's social, physically, mentally, and social emotional, and everything." A mother observed, "Something happened with the doctors where they stopped being personal to everybody, and take as many patients as you can and get them out as quick as you can. Things get missed from trying to treat so many children in such a small amount of time. So I don't know when it really shifted from like family medicine to like factory medicine, but it happened." Lastly, parents felt that enhanced clinician communication and careful attention to child development and family well-being are key opportunities to strengthen parent-clinician relationships. I feel pediatricians need to have more to get to know their patients a little bit better. Spend some time with the parent talking about what their kids are like, or talking to learn a little bit more about their kids so that it is a more personal experience instead of just talking about like, "Why are you here? Okay, all right, here you go, here's your prescription," and then you leave.
Our findings align with prior work in suggesting that clinicians need to build strong, trusted partnerships with families to be able to promote early relational health most effectively. Policymakers and clinicians that are doing this work might consider strategies that provide more time during visits and more continuity with clinicians in order to facilitate that relationship building. Our parents in this study also suggested that enhanced clinician communication and attention to child development and whole family well-being are really important in strengthening the physician-parent relationship. Strengths-based developmental surveillance, programs such as Reach Out and Read, and cross-system partnerships with models such as Help Me Grow might be strategies to help achieve these goals. Policymakers and clinicians might use this information to strengthen efforts to achieve a paradigm shift towards a relational health framework. While understanding parents' perceptions and needs is a key first step, partnering with families will be critically important in this effort.